topic that's been in the news in the last 24 hours. And this is a new report looking at the extraordinary incentives that people face for, well, basically for going onto sickness benefits. Report from peers in the House of Lords looking at the incentives that the benefit system has these days. Basically say it incentivises workers to say they are sick. They get more money that way. Well, let's talk about this with Sophia Worringer. She's Deputy Policy Director at the Centre for Social Justice. Very good afternoon to you, Sophia.
Good afternoon.
Thanks for joining us. I'm afraid we've not got much time, obviously, with all this breaking news. But basically, their peers are saying, look, in this report that, you know, if you're eligible to claim health-related benefits, you can basically double your income. People are self-diagnosing.
Yeah, absolutely. It's a huge issue, and the peers are right to put their finger on it. And let's not forget some of the costs involved with this. Health-related benefits set to reach 100 billion by the end of this Parliament, forecasted to be 3% of GDP. That's a cost the country can't afford. And I think what's interesting in the last couple of weeks and months is that this has become less of a right-left issue. And in fact, more people who are classically on the left are trying to start to question this narrative of what is going on with the mental health of the nation. We've had Tony Blair, former Prime Minister, saying the ups and downs of normal life are being seen as medical conditions in an unhelpful way. And I do think that the pendulum is shifting on this issue, because we can't afford to pay the bills anymore. And as you said, the incentives in the system lie all in the wrong places. If you can double your income by being out of work and claiming sickness benefits in the long term, then people are going to move towards where those incentives lie.
Yeah, I mean, but that's the thing. People aren't stupid, you know. I mean, they might be, frankly, swinging the lead, but they know they're going to get more benefits. And basically, once you're on these sickness benefits, you're on them for life.
Exactly, and that's what's been driving the problem. Is there has been an increase in the number of people applying for them, about a 20% increase, but the huge proportion is that people are not coming off them, and reassessments have really dropped off, which were paused during the COVID-19 pandemic but have not picked up again. So as you said, once people are put into this cohort of out of work for long-term sick, they're out of the conditionality of universal credit, which is in fact very good at getting people into work, and therefore unfortunately parked there. And that is therefore such a big hurdle for them to get back into work, not just in terms of the money incentives, but also emotionally and mentally, the feeling of having to get back into work after maybe years being out. It feels like something that's beyond people's reach. And the government recognise this as a problem, but unfortunately their Get Britain Working white paper is going to produce a consultation. There's further stages coming down in March. There's more detail coming. And I do think Number 10 have expressed their frustration about how slowly this problem is being gripped for the Work and Pension Secretary. So there's a lot more work to be done to get this problem under control.
Well, again, the Tories didn't get to grips with any of this. They allowed this to explode. There's no reason to think that Labour are going to, although we simply cannot afford for them not to get a grip on it. So appreciate you joining us, Sophia Worringer, Deputy Policy Director at the Centre for Social Justice think tank.